Hi, everybody. We are going to go ahead and get started. I want to welcome everybody to the sixth meeting of CSG's National Long-Term Care Workforce Network. I'm Sean Sloan. I'm a senior policy analyst at the Council of State Governments here at the national headquarters in Lexington, Kentucky. Here is our agenda for today. After a quick introduction and project recap from me, we will introduce you to our presenters for today. We're going to get an introduction to the direct care workforce and hear why real opportunity is an essential part of job quality from Amy Robbins. She is Director of Advocacy at PHI, the organization that is the nation's leading authority on the direct care workforce. Then we are going to hear about an initiative in Hawaii to sustain the certified nursing assistant and licensed practical nurse workforces with a cross-sector educational glide path. We encourage you to make extensive use of the Q&A and chat functions here in Zoom to submit questions and comments, which we will turn to in the last half of the meeting. Please stick around until the end, and I'll give you details about our next network meeting, which is coming up during the last week of September. So just a quick project recap, a quick reminder of what our current project is all about. Last year, with the support of the Commonwealth Fund, CSG put together an 8-state interbranch task force of state policymakers that convened multiple times over the course of the year and advised us as we put together the CSG Long-Term Care Policy Guide, which you will find on the CSG website. One of the three focus areas that we had for the project last year was revitalizing the direct care workforce and supporting family caregivers. And in the policy guide, you'll find a number of strategies states have deployed to address those issues in recent years. We are pleased to again be working with the Commonwealth Fund this year to build on the work that we did last year. This project includes using the model for last year's 8-state task force to build out this national long-term care workforce network. We're developing a new website, a national online resource center that we hope will become a clearinghouse for all of the relevant work being done on long-term care workforce policy around the country. We hope our network members will share relevant legislation, policy reports, and other materials that we can post to the website. And if you have links you would like to share today, please feel free to do so in the chat here on Zoom. You can also tell us about who you are if you're new to these meetings, and perhaps connect with other attendees working on these same issues. And of course, you can submit questions for our presenters. We also, with this project, have the opportunity to provide technical assistance services for up to 5 states. This is something that we're really excited about, and we will be ramping up our promotion about in the coming weeks. If you believe policymakers in your state could benefit from a detailed briefing and action planning session on how they might move forward with policies to address long-term care workforce needs, please get in touch. So without further ado, we want to dive into our main topic for this meeting. We've recognized for some time, and we've heard from many of you, that facilitating career advancement is an essential component of addressing the challenges facing the long-term care workforce. And although we've touched on these issues at previous meetings of the network, I'm excited to do a deeper dive and kick off a full-blown conversation today on career pathways and glide paths. We plan to continue the focus on these issues during next month's meeting as well, because they certainly warrant an extended focus, and there are quite a few states doing significant work in this area. I am pleased to welcome Amy Robbins. She is a Director of Advocacy at PHI, which is hopefully an organization familiar to all of you. They have many great resources on who the direct care workforce is and what's needed to strengthen that workforce. Amy is responsible for designing and leading PHI's nationwide advocacy approach, working to promote public policies and other initiatives to improve compensation, training, and a range of opportunities for the direct care workforce. She first joined PHI in 2007 as the Massachusetts State Director and served in that role until 2012. She returned to PHI in early 2022 as the Director of Advocacy. In between, Amy operated an independent consulting practice where she worked with nonprofits, medical systems, and institutions of higher learning to bring new approaches to the caregiving crisis. She also spent time on Capitol Hill at the U.S. Department of Labor, the Seattle King County Workforce Development Council, and Jobs for the Future. Amy, thanks so much for being with us today. Please take it away.
Thanks so much for that introduction, Sean. I'm really pleased to be with you all today to talk about the direct care workforce and overcoming the crisis that we are currently in as a country. Next slide, please. Next slide. So my focus today is to really talk about the direct care workforce. I know many of you were probably on the call last week that focused on one segment on the home care workforce. My comments are going to be directed at the broad direct care workforce of 4.7 million workers who provide support to older adults and people with disabilities across the long-term services and support spectrum. This is a predominantly female, a predominantly of color workforce, and there is a significant number of workers who are immigrants. I want to just note on here, I'm going to go through some kind of context setting statistics that are national numbers, but you can access our workforce data center, and there is a link on this page here of my PowerPoint, which I'm sure will be shared after the session. There's a link to the Workforce Data Center here where you can find these statistics on a state basis. So if you're interested in how these numbers break out in your particular state, that is available on our website. We update those numbers every year on Labor Day, or around Labor Day. So you can look for some new updated numbers coming at the end of the summer. Next slide, please. So this is the fastest growing workforce in the country. We are expecting to add 2.3 million direct care workers by 2030. As you can see, it's outpacing other occupations like cooks, fast food workers, and it really is being driven by our aging population and the fact that people are living longer, meaning that they are more likely to need support of some sort over the course of their lifespan. And that support comes often in the form of a direct care worker. Next slide. This is a slide that keeps me coming to work every day because I find this really daunting. So this is the total number of job openings. And what that means is it's the number of new jobs that we're adding to the economy in combination with the number of jobs that we're going to need to fill because of departures from these occupations. As you can see, fast food workers outpace that number. That's the only occupation that outpaces direct care workers. And you can, I'm sure in your experience, you've probably recognized that fast food workers turn over at a fairly fast clip. That is happening in the direct care workforce as well. And what that really speaks to in my work is that we have a fundamental job quality crisis that we need to solve in order to reduce the turnover and really reduce this particular challenge in order to have the capacity that we need to meet the needs of our aging population. Next slide. So one area of focus, I think when the direct care workforce is mentioned, people often talk about it as a low wage job, and it is in fact a low wage job. And I think this, the home care graphic on this was shared last week. So I just wanted to point out that we have made some strides in terms of increasing wages across across direct care occupations, but really, when you're looking at the $14.50 an hour kind of median wage rate, we are far from a living wage. Importantly, I just want to focus in on the blue line for a minute, which is the home care workforce. This is the largest segment of that 4.7 million workers. There's about 2.6 million of them that are in home care. It is the fastest growing segment of this workforce as more people want to age in place or age in home and community-based settings. Demand for this workforce is going to continue to be very high, and yet they are the lowest paid segment of this workforce. So just something to keep in mind as we talk about job quality issues. Next slide, please. So PHI's tagline is quality care through quality jobs. And we fundamentally believe that if you are working to improve the quality of long-term care services and supports and care outcomes for our most frail individuals, that you really have to invest in the quality of the jobs of the people who are providing that care. And we are, as a nation, failing on that right now. We have significant economic instability, obviously driven by those low wages. But strikingly to me, what that really translates to is that 40% of this workforce live in or near poverty, and 43% rely on some form of public assistance, whether it's food stamps or childcare subsidies or housing supports, 43% in order to make ends meet every month. This is a very dangerous occupation. There are high rates of injury, and many workers lack access to health insurance, making access to care for themselves very challenging. And a little bit more on that workforce instability. These statistics are specific to direct support professionals, but really you'd see a similar kind of relationship of the numbers across other occupations as well, where you have a high rate of turnover, which translates into employers not being able to keep up, right, with placing new workers, so that what happens is they end up with high rates of vacancies, where you could imagine that, or what happens is that either workers end up being asked to do more with less, have higher caseloads, say in a nursing home, or consumers are denied services because employers don't have the capacity to meet the needs. They don't have the staffing available to be able to provide care. In either case, care outcomes for the individuals who qualify for care and need care, can be impacted. And even just to put a finer point on that, high rates of direct care workers, and particularly DSPs here, leave their jobs before even a year is up. And that's really putting a lot of stress on the front line of employers who are in the, providing training and onboarding to staff, and yet continually seeing that revolving door happen. That is expensive. And that is also impacts quality care, where you have workers that are, starting to develop maybe a relationship with a consumer, and getting to know their needs and their preferences, and being able to provide really good care. And then they end up leaving, and that whole process starts over again. That's frustrating for the employer and for the consumer of care, and really speaks to the challenge of job quality. Next slide, please. So what do we do about that? We have identified 5 pillars of job quality for this workforce. I'm not going to go into too much detail on all of these, only just to touch on them and say quality training. Obviously, these workers really need to be trained well to be prepared for what they encounter in the course of their work, to be able to meet the needs of individual consumers, but also to be prepared for whatever they might walk into a home, and be able to communicate about that, and see what, be able to respond to changing conditions, a whole range of things that happen in those jobs, and really require a high level of good training. Fair compensation, we've spoken about that. Quality supervision and support. I don't know if you've heard the phrase, people don't leave jobs, they leave their supervisors. That is absolutely something we see in this workforce. Strengthening supervision and the supports that workers receive in these jobs really can have a dramatic impact on retention. And respect and recognition, we are seeing a number of states start direct care workforce advisory panels at the state level, where workers are being tapped really to help inform policy efforts at the state, but also employers who are incorporating direct care workers more into their care teams. This is really the workforce that is the eyes and ears in a home and on a consumer, and on a very regular basis. And I think recognizing that those workers can really contribute to quality care outcomes when their voices are heard, and giving them a role in that is really important. And then the last one is real opportunity, and we're going to talk about that. But I just wanted to highlight for a minute that while we're going to talk about advancement and career pathways, that this kind of comprehensive approach to improving job quality is really necessary. I think if we improve one aspect of these jobs, but we aren't mindful of the others, that we will still see deficits. It's really an all-inclusive approach that we need to be taking. So next slide. So I wanted to just draw a distinction between career lattices and career ladders as we start talking about career pathways. Career lattices is where we focus. PHI focuses quite a lot of our efforts. And this is really an acknowledgement of that 7.8 million figure that I started with, that we need people who want to do this job, and who are retained to do this job and have opportunity within this job, in order to reduce that 7.8 million figure, and certainly to meet the demand that we're going to see over the next few years. And this means that even within the established scope of practice, it's possible to create opportunity, right, for increased pay, for increased responsibility, for increased specialization, that can help really there are many aides that want to stay and be direct care workers, but they want to have an opportunity to learn and do more. These are ways of kind of breaking that out. It can happen at an employer level. It doesn't always require a big policy change. And it's just important, I think, to keep in mind that we need to take some steps to stabilize this workforce, and thinking about career lattices can be an important factor to contribute to that. Career ladders then are more about providing opportunity beyond the direct care occupation. So taking, hopefully, what people have learned and experienced as direct care workers, and creating a pathway to either a nursing program, or onto an LPN or a nursing program, or other healthcare occupation roles. And there are a couple of examples I'm going to share with you about that. Next slide. So sort of in the interest of time, I'm just going to highlight a couple of things here, and I included a link for more information in the slide, but this is, so the employer-based advanced roles, there are 2 of them that we have worked with employers and in partnership on and in developing. We did them as pilot projects with foundation funds, and we're able to demonstrate the impact on retention and the impact on care outcomes. So we saw reduced hospitalizations and critical care events with the employers that initiated these rules. And now we are working with states to perhaps incorporate these rules into their direct care infrastructure. So that's really exciting next step. The other state effort that I wanted to highlight is the concept of a universal aid. And it's a term that's gaining some more traction, but I think that it's not a common definition of what it actually is. And I think you'll hear more from Wisconsin next week on their work on this. But one of the challenges of the direct care occupation itself is that it's they're Medicaid funded programs, right? And the requirements of the workers don't always articulate across settings and across occupations. So there's more and more increasing efforts within states to really articulate that training and identify the core competencies that are required to be a direct care worker, and then to be able to add on the specialization training to be in different setting types. But to allow, the ultimate goal is really to allow workers to move across settings more easily, rather than having to start over every time they, perhaps want to explore a job in a different part of long-term care. So I think that's a really exciting development. It's very challenging. And I listed 3 states that I know are working on this and are certainly ones to watch. Next slide, please. So I don't expect you to be able to see this slide. Again, I think this is something to look at afterwards, but I wanted to share this. This is from Tennessee. I wanted to share this just as a really clear articulation of a career ladder in healthcare, where it shows, where you're at in terms of your education, what that articulates to in terms of a career opportunity. And then they have broken out, they call them badges. Really kind of module-based training where you can have a more accessible, perhaps, chunk of training that can contribute to your advancement and increased opportunity in healthcare. And it's very clear articulation. So you can see, if you really want to be, get your bachelor's degree, what does that mean in terms of what opportunities you might have from where you're at right now? And I think this kind of really rational, clear approach is really important visually for workers to be able to see kind of what's in it for them, right? What are the opportunities? Where can they possibly go? And what's the value in doing that? So I wanted to share that. And one other example, next slide, please, which is from California. They use the term universal care worker in a different way than I used universal worker. But there's a link here to the California report, which again, I think is a really clear articulation of a structured career pathway and an advancement pathway that California developed. I will say that this was proposed in 2019. I don't believe it was implemented. So I can't tell you the impact of doing this, but I really just share this as information and a place to really look at how a state has framed this up. Next slide, please. All right, and then just briefly, there are a lot of federal opportunities. happening. President Biden's executive order focused a lot on the direct care workforce. This is an exciting step for President to lay out the priority around direct care workers, and to really have a call to arms from his administration. There's a lot of work to be done. Proof is in the pudding. There's a lot of coordination that needs to take place, but I highlighted a couple of items here that were of interest specifically for the direct care workforce, and hold some potential, I think, for the work ahead. And then also included a few pieces of legislation. Congress has been definitely active in this space, and I apologize, I wasn't able to get the links to work in here, so I did not include them. But these are three bills that are specifically focused on the direct care workforce. There's a lot of other legislation around increasing access to home and community-based services, on Medicaid innovation, and a number of other aspects to long-term care, which is really exciting. Next slide, please. And the last thing I wanted to leave you with is a slide, or second to last thing, is a slide that was created by one of our partners in Michigan that just highlights the different aspects of when you're working on policy change, and you're working in a coalition with a wide variety of partners. What are really important things to keep in mind that drive success? So I just share these with you all that probably look familiar to many of you. And I wanted to highlight two of them. One is having a common definition of direct care workers. I think that is a challenge for many coalitions and work in this space, is to really be clear about who you're talking about and who you're not. And the other thing is advocacy on behalf of all direct care workers. It's tempting to, focus in on, we have a nurse aid crisis in nursing homes, which we saw a lot of focus on in COVID, and we certainly do have that crisis. But we need to really think holistically about this workforce and be working towards solutions that are going to lift all boats, as they say, across the spectrum of care. So I just wanted to leave you with that. And then next slide. This is again connections to our our website and more about us. Next slide. And I highlight here 4 specific resources on the direct care workforce that are available on our website that may provide you with some more food for thought. I highly recommend taking a look at those. And then next slide. And then that's my contact information. I kind of threw a lot out there. I'm happy to help you find things on our website or answer any questions that you might have. And I'll look forward to our conversation. Thank you.
Amy, thank you so much for that presentation. And as usual, we will reserve questions until the end of the hour, but please stay with us. And if you do have a question, you can submit it in the chat or the Q&A here on Zoom, and we will ask as many as time allows. And Amy, feel free to take a peek and join the conversation in the chat if there is anything to respond to in there, or anything we should bring to the attention of the full group as we move along here. Right now, I want to welcome our next presenters. As many of you hopefully know, Hawaii was one of our 8 task force states last year. And Senator Sharon Moriwaki and Caroline Catareo, the director of the Executive Office on Aging, were regular participants in our task force meetings, and also curated a great Hawaii-specific conversation on long-term care that became, as I understand, a catalyst for a number of initiatives that have moved forward in the months since that project wrapped up. Senator Moriwaki is joining us today, and she recently called to our attention a cross-sector initiative that is creating an educational glide path between the CNA and LPN workforces. Senator Moriwaki, are you with us? Can you talk a little bit about that?
Aloha. And thank you, CSG and Sean. It's my pleasure to introduce to you two people who have been very instrumental in the career glide path for long-term care space. Wesley Lowe is the CEO of what we call Ohana Pacific Health and Halemakua Health Services. And they serve a number of islands. So Hawaii, if you don't know, is a state of islands. And so our challenge is not only driving to rural areas, but it's also having to fly mostly to neighbor islands. And since the pandemic, we've learned that Zoom is a very good way of connecting. So I'm really pleased with one of the silver linings of the pandemic. And Jana Hoshide is with our workforce development. She's the senior director for health workforce development with Healthcare Association of Hawaii, which is association of hospitals, long-term care facilities, physicians, and has been very instrumental in creating this glide path. And they have a lot to present to you, but I did want to thank CSG for bringing us together, because it is, as Amy says, the coordination between the educational sector and the employer, which in the past hasn't occurred. And so we have the CNA shortage, but also the LPN shortage that you'll hear about. And it is the recruitment and retention by having both sectors working very closely together and developing the competencies and the standards that are required in the work setting. So I'm really pleased to have them present to you their program. And we have 32 people in the program already since the time that they started last year. So I welcome them to talk with you. I think Jana might go first with the overview. Jana.
Thank you, Senator. Thank you for having me here today. Again, I'm Jana Hoshide. Actually, I am going to hand it to Wes because I thought it would be helpful to hear about the journey up to this point. I think Wes wanted to give some context to that. So Wes, over to you.
Thank you, everybody. Nice quote unquote meeting you guys. Yeah, I just wanted to give a little context of sort of what transpired, and there's certainly been a lot of lessons learned. I always think that it's important to understand your mistakes to make for a better program, and we're really fortunate to the place where we're at now, although we got a long way to go. So several years back on Maui in particular, we're predominantly a Medicaid facility. 85% of our residents are Medicaid. So obviously the financial thing is a tough situation there. And we serve the entire community. We're the only nursing home in Maui right now. But what happened was that we started seeing our longtime CNAs retire, and we didn't have any CNAs. And we have chosen to go down the path of licensed practical nurses to staff our nursing component. But I was paying about $1 million a year just to get agencies there. First step I did was actually to try to raise the wages of the LPNs, and my staff kind of started giggling, saying is that it doesn't matter how high you raise the wages. There was no licensed practical nurses on island. We did not even have a program. I'm not going to get into all the details, but we did start a CNA school, and that was an attempt to start filling the CNAs, and we found out that the retention for CNAs after a year was a whopping total of 0% retention after a year. So it wasn't the school that was the problem. So we kind of learned that. On the CNA side, then we started trying to do an apprenticeship program. We actually got to be a registered licensed apprenticeship program, but we had a little bit better retention rate after a year, probably around 5 to 10% retention rate, because we got them up to the level of a CNA, but then they were just a CNA. So we realized that there were some issues here. Meanwhile, we on the LPN side, we started a program, and we begged our community college to start an LPN, include us in the LPN to RN pathway. So the LPNs were able to they would finish their 1 year, and we had to hire a clinical educator, which was a really scary thought for us because we were already hemorrhaging money and the agency costs were more for us. So we had to bite the bullet and actually invest more money just to have this program. After a year, they would have to work in our facility in the state of Hawaii for a year before going to become an RN. So it worked really well for several years. We kept on having a pipeline built. So they kept on filling the pipeline after a year. They would work for a year, then they would go on to be their RN. And then what happened after that was people started liking our training program, so they started hiring them, and the pipeline actually broke. And so, you know, what was a success started to turning into a little bit of a cost for us, and we weren't retaining our nurses anymore. And then actually a silver lining during the pandemic was that we were having a sort of one of our final cohorts coming through, and halfway through the year, we couldn't even allow the students into our facility. And at that point in time, thanks to the County of Maui, we were able to access some CARES money, and we actually ended up hiring them, which was really a watershed moment for us, because that's where we kind of got the idea of this earn and learn. Literally, people were crying, the students were crying because they were so happy that they could have a job. And these were, our workforce was really single mothers that really only could afford to go to school for a year. And we were able to create this earn and learn thing during the pandemic. And from that, we've now created sort of a standalone LPN program. They'll have to work for us for 3 years, but CNAs can come in. And we have discovered that having this pathway and keep on filling it with, you know, people that can continue to get to higher levels. I mean, they are getting too close to living wage after a year, right? So from I think Amy was talking about some incredibly low wages as direct care workers. And, you know, I think it's been really a great partnership. The Healthcare Association, Jana, will talk to you about her program. I would say a lot of lessons learned. I think one of the things is we do need the partnerships. You need to have capacity to do this. We were fortunate that some funders gave us some money just to build our capacity to do this. This thing, you can't just do it on you know, a small budget. You need to have the administrative support and the clinical pathways to do it. But with that, I'm talking too long already. I'll turn it over to Janet to explain the program. But thank you.
Thank you, Wes. I think that context is important because we're going to talk about innovation here. And so it's important to have that agile mindset of trying things, maybe failing at things, and keep on moving along and improving along the way. So with that, I'll jump into our presentation. Can I get to the next slide, please? I just wanted to recognize, because while Wes and I are presenting today, these individuals here have also contributed to creating this presentation. So Mary Farmer from the University of Hawaii Maui College, Carissa Hawley from Hale Makua and Ohana Pacific Health, and Carrie Oliveira from the Hawaii State Center of Nursing. So these individuals are key contributors to the project and also helped to create this presentation, which was recently given at the National Forum of State Nursing Workforce Centers annual conference. Next slide. So let's get started with the problem and the critical shortage of CNAs and LPNs in Hawaii. Next slide. Between 2019 and 2022, and we can go ahead and click on for that animation. You can see kind of the needs for CNAs. So from 2019 to 2022, we had a change in vacancy from 10% to 18%. That represents an increase from 417 openings to 744 open positions of CNAs. If you look at LPN, the vacancy rate increased from 20% to 30% with open positions at 211. And so while 211 openings might not seem that large to other states, we are a very tiny state, and compared to the supply or the number of students in our LPN programs, which is only 30. So 30 supply compared to 211 demand, we have essentially an 86% gap between supply and demand. Next slide. So the reasons for this gap between supply and demand, one is geography, as Senator Moriwaki shared. Right, we are physically isolated from the mainland, which is about a 5-hour plane ride away. Also within the state, we have multiple islands, and so traveling between the islands is about an $80 to $130 airfare. So essentially, it's not feasible to move the workforce around, and therefore the problem requires a localized workforce development solution. Next slide. The second reason is education capacity. And so just as there is a workforce shortage of the clinical professions, there is also a shortage of education faculty and also clinical placements. And so this impacts the expansion of students both in CNA and LPN programs. Next slide. And then the last reason, of course, is money or livable wage. Can you go ahead and click through? We are one, if not the most expensive state to live in. And so if you look at the second number here, which is the ALICE threshold, it stands for Asset Limited Income Constrained Employed Threshold, which in Hawaii is about $100,000 for a family. And so click one more time through. As we know, CNAs do not make a family livable wage, which might be okay for a recent high school graduate or those who are just starting their career. But as their family and both their financial needs grow, they will want to and essentially ultimately need to advance. And so here you can see the financial needs growth between CNA to LPN to RN and beyond. And so it is critical that entry-level employees have opportunities to advance. The challenge is that the LPN programs in Hawaii require full-time school, so students would have to quit working. But as we know, most of our CNA population cannot afford to stop working in order to advance their careers. And so failure to develop an earn and learn model essentially traps people in low-wage roles. And if there is no opportunity to advance, we essentially lose these folks, the CNA workforce, to other industries and then potentially other states with lower cost of living. So next slide. So our solution was to create an LPN innovation team. Next slide. The team was charged with increasing the number of CNAs who advance to LPN, and especially for those who must work at the same time. Next slide. As you can see here, it is truly a cross-sector collaborative. And so we at HAH essentially function as the convener and the project managers. We have employers with Wes and his team at Ohana Pacific Health and Hale Makua. We also have Kaiser Permanente in partnership with their union. We have the Hawaii State Center for Nursing, and then also the University of Hawaii Maui College, which has a long partnership with Wes that he had mentioned. And more importantly, they come with an innovative spirit. Next slide. So when we talk about the need for an earn and learn LPN program, our goal was to create a glide path. And so a glide path is an earn and learn pathway allowing working individuals to maintain their jobs while advancing their health education credentials. And so it is also a very effective retention and attraction tool. Next slide. A glide path essentially removes barriers and smooths the transition from CNA to LPN. And so here's how the various partners contributed to the innovation team. So again, we at HAH convene the partners. This collaborative has been meeting every other week for the past 2 years. And we also worked closely with our state and community college system to secure competitive federal grant funding. And this funding has been used to support the LPN tuition. Maui College and Mary Farmer developed the program and the curriculum. So the curriculum includes online asynchronous didactic education and also clinicals integrated at the place of work. And so all of this is in support of that earn and learn model. Also, the prerequisites were created to better align to the LPN level, unlike other programs that align more to the RN level. In addition, the acceptance rubric gives points and weight to work experience, which essentially increases access to the program for those who are working. So for the employers, we have Ohana Pacific Health, Halemakua, and Kaiser with their unions. They help to recruit students and also support clinical education. For example, as Wes mentioned, Wes has hired several clinical instructors that are dually employed by both the community college and also the employer. And then lastly, we have the Hawaii State Center for Nursing, who has provided the support for program evaluation. Next slide. And so what makes the glide path innovative? And so the first thing is that it leverages employer resources to reduce education capacity limitations. And so there is this unique partnership between both the employer and the education institution, both in sharing the clinical educator for employment, as I just mentioned. And then also the clinical placement shorter no longer becomes an issue because students essentially do their clinicals at their place of work. It also mitigates common challenges for working students. So the use of holistic admissions places more weight on prior healthcare work experience. So work experience essentially gets more admission points, allowing students who may not be competitive under traditional admissions criteria, maybe because they do not have the highest test scores, it gives them an opportunity to be admitted into an LPN program. Also, it creates a legitimate pathway for career advancement. And so employers and employees agree to terms and ensure that the employee has opportunities to advance to the LPN role after graduation. And so this really removes any uncertainty for the student about whether pursuing the academic progression is worthwhile for them. Next slide. So in terms of early wins and lessons learned, next slide. Our students started in January and will end in December of this year. There are currently 4 cohorts on 3 islands. And right now we're a little bit more than halfway through. And so I want to talk through some of the lessons learned and some of the stories. And so I'm going to have Wes also chime in here. And so here's a picture of our Maui cohort. And so Wes, do you want to just talk a little bit briefly or share about Kehulali?
Yeah, Kehulali was a unit aide, and you know, frankly, what I got to say is a lot of these people they want so much to move to a higher level. Many of them have to go to work just to help pay the family's grocery bills. It's really a sad story, and you know, I firmly believe that for us to take care of our, as we call them, kupuna, our aging community, we have to be a healthy community ourselves. So we need to rise and bring our youth up. But when she found out that she could get and earn and learn her pathway, she actually started crying because you know, she's a working mother. She had lost her opportunity to become a nurse. She thought that she would never get this chance, and I think you see this time and time and again. You know, I know there's a bunch of other slides. I just talked to one of our original LPNs, and same thing. She had 2 children out of high school. She is now our staff development coordinator, and her parents are her father's a bricklayer and a new immigrant, and she is just can't believe she's walking on a cloud, saying that she can't believe she's helping things. And so I mean there's a lot of as you go through the slides, there's so many stories about this, and I think this is our new workforce coming forward. You know, we don't have this huge amount of demographics helping us on the workforce, as we all know. And so I think that this is going to give people a living wage and actually rise our community up. You know, I think as Amy said, we can float all boats by bringing our community and advancing people.
Thanks, Wes. And next slide. Here is our Kauai cohort. It has a mix of newly hired CNAs as well as a person here who was a 10-year CNA, a mother of 2. And so again, the story, she was rejected from the RN program because it's so highly competitive. And so just incredibly appreciative of being in this program. And then next slide. Here's the Oahu cohort. And so what's great about this is we have some other programs happening that provide tuition support to train new CNAs. And so with that grant funding, we have some new CNAs that are entering into the workforce, including Martha McDermott here, who was recently trained under one of those CNA programs and is now in this LPN glide path. And then the next slide. This is a picture of the Kaiser cohort. So the Kaiser cohort has a mix of medical assistants as well as techs, also training to be LPNs. I think what's great is this partnership between the acute care hospital and then long-term care, which has been really essential for success of the program. So while majority of the clinical training is done in the long-term care setting, the students also need outpatient clinical experiences through all the life stages. And so that includes peds and OB. And so this partnership with Kaiser has been able to meet those requirements for the program. And so next slide. So just some interesting data about the students in the program you can click through. 50% of the students previously applied to a nursing program. In Hawaii, it's highly competitive because we are constrained by the number of students we can have in the program. And so we have only a 28% acceptance rate for our current LPN programs. More than a third of the students are over 35 years old. A third have 10 or more years of experience in healthcare. Which also leads to them having, 45% have 2 or more jobs. And so, as Wes mentioned, we hear time and time again that it was their dream to go into nursing, and that, they are incredibly thankful to have this new opportunity. And so, while we're seeing a lot of challenges and it's hard to balance work and education program at the same time, it is phenomenal to see the level of engagement of the students. And so they are very, very highly motivated. And so we're hearing that the level of motivation is higher than traditional LPN students. Next slide. We have 1 semester left out of 3 semesters. We also have a pretty high retention rate. So I think Wes mentioned before, retention for CNAs being almost at 0% after a year. So happy to say that we're retaining 32 out of 34 of the students. And then one more click. What's great is that we are tracking all of the students' performance, every single test score, assignment, and we are very happy to share that they are performing well and are on track to graduating. So next slide. As mentioned before, we're finding that the glide path is an effective attraction and retention tool. And so, Wes, do you want to share about Jalen?
Yeah, so Jalen actually, she was actually on the mainland, and she wanted to come back so desperately to get in the program, and she wouldn't have had the opportunity to come back. And in Hawaii, we are seeing out migration of our 25 to 64 years olds. And so it's a really dangerous situation. So she's just been a fabulous, great success story for us. Just sort of our star in the Kauai community for us right now, though. But yeah, it's a very rewarding to see people come back to the state, for this opportunity.
And next slide. So in terms of the challenges, I think we underestimated the challenge of work and school life balancing, especially for those with multiple jobs. And so we have been serving the students in terms of the support they needed. We found that 6 of them needed additional support for issues such as financial, time management, family, and so forth. And so we devoted RAP services navigators. So they connect students with additional services, including financial support. And then we also have a mental health counselor for the students as well. We also found that the students need more time to complete assignments, but when they're given this time, they have really high levels of success. And so overall, we're going to continue to track metrics and success for both academics and, of course, passing the NCLEX and licensure, as well as work performance. Next slide. Here's just a snapshot of some media coverage for the program, including we recently received some governor's financial support for the next cohort. And then last slide. We are seeing an overwhelming amount of interest from employees, the public, as well as employers. One employer's interest list includes over 250 employees. And so we're working to expand the cohorts for next year. And so moving from 32 to 60 seats, and then moving to 4 islands. So we're going to include our largest island, the island of Hawaii there. We are also working on a longer term sustainability plan that will need additional faculty and then continued tuition and clinical education support as well. And so that is the end of our presentation. Thank you folks for allowing us to share today.
Jana and Wes and Senator Moriwaki, thank you so much. We do want to turn now to questions for any of our presenters this afternoon. As always, you can type a question into Zoom, or you can raise your hand if you'd like us to call on you, and please wait to be unmuted. I know we had a question earlier in the Q&A about, and this is probably for Amy, as we see these career pathways projects around the country, do any of them ever include MD as sort of, you know, a reachable goal for these folks?
It's a great question. I haven't seen an articulation of a career pathway that begins with a direct care occupation that goes all the way through to MD. That's not to say that, you know, somebody couldn't start as a direct care worker and continue on a path to reach that level. But I think it would probably be very few people that would go through that articulation from start to finish. And so I haven't seen that as a focus area.
You
And
know, Sean, if I could just
sure.
chime in a little bit. You know, I think that it's to be seen yet to get to MD. I think that we are working on a pathway now from post-acute care to acute care to get sort of the new grads to actually spend a little more time in the post-acute care and train through a nurse residency program. And I think after that, you know, then once they get to RN, I think that we certainly have interest in the APRNs or, you know, type of pathway. So I think, you know, still early on in the game on this one, but for sure, I think that definitely the APRN is a pathway that's possible.
And Amy, you talked about this universal aid model and things like that. You know, what about those CNAs who determine they may not want to go into nursing or study to become LPNs or RNs, but they want to continue to assist residents and perhaps continue to work in that sort of long-term care environment? Do there need to be more different kinds of opportunities for them rather than just a straight up and down, you know, line of advancement and responsibility within the field of nursing?
Oh, absolutely. I mean, I think across the board with the direct care workforce, we need to build in opportunity for all of those occupations, for home care as well as those working in institutional settings. I mean, we are seeing good examples of those sort of the career lattice section that I was talking about. I shared more examples from the home care perspective because that's the biggest segment of the workforce and fastest growing segment of the workforce. So we are seeing a lot of innovation there because the need to draw workers into that and to retain workers in home care is so acute. But nursing homes are doing really innovative work in that as well. And I think we'll see more kind of experimentation in that space as you know, nursing homes work to recruit and retain their CNA population. I mean, I think the Hawaii example is an excellent one. Obviously, that's a career pathway, but I think even when workers can see that there's opportunity, even if they're not ready for it right now, that's really meaningful for someone coming into that kind of a job. You know, maybe 5 years down the road, they're ready to take that on. I think that's a really important signal of how there's growth opportunity in these jobs.
And Jana and Wes, I know there was a question earlier about how long do students stay in the CNA work role before they're able to move up?
So they have to be a CNA to even apply for the program. At least the current way we have it set up. So typically they are at a minimum of for this first cohort, they were 3 to 6 months in, because we actually have to accept them before the program started. We have some that were restorative aides for, I want to say, probably about 10, 12 years. And this program came up, and they're ecstatic to get into the program. So we have a wide variety, but we do require them to be actually a CNA working for us to even apply for the program, because obviously part of the goal is not only LPN, but is also to attract more CNAs. And then once they are once they're in the program, they have to work. I think we're holding to a minimum of 20 hours a week as a CNA. So we keep them during we keep them busy during their schooling too. So that's kind of how it works.
Well, I'd like to just add in, one of the things we're looking at is getting the high school kids more interested, getting them into the workplace with the Department of Education. So we are looking at that. Once we stand up the program that Wes and Jana have, to look at what we can do to then incorporate some of that into the high school, so that you have a feeder into the CNA and into a community college program.
It's actually fascinating. We have been sharing this opportunity with the high schoolers. And so I think, not a lot of them are interested in just the CNA profession alone, but when you add the opportunity to progress into LPN and RN, that is really creating excitement, not only with the students, but also the teachers and the parents.
And I think the important thing is this career ladder of seeing that there is a progression, it's a career in the profession, and not just stuck in, being a CNA. Yeah.
Great. Well, folks, I know we are about out of time, and want to be respectful of everybody's time, but we want to thank again our panelists for joining us. A couple of quick notes before we go. As I've noted before, we are going to be taking a bit of a break between now and the next meeting. The Advancing States HCBS conference is coming up the end of this month in Baltimore. Hope to see some of you there. And next month, CSG will host 2 Medicaid Policy Academies in Alexandria, Virginia. We will resume our regular meeting schedule for this network during the last week of September. We're looking at either September 25th or 27th to continue our focus on career pathways. We expect to be joined by Natasha Bryant, who is a Senior Director of Workforce Research and Development in the Washington, D.C. office of the Leading Age LTSS Center at UMass Boston. Also, Kevin Coughlin, Policy Initiatives Advisor at the Wisconsin Department of Health Services, will join us to talk about the WIS Caregiver Careers Certified Direct Care Professional Program. And we'll get an update from the Moving Forward Coalition on one of their recently released action plans, which focuses on expanding CNA career pathways using the Federal Registered Apprenticeship Program framework. We hope you will be able to join us, and we will send you a Zoom registration link once plans are complete for that meeting. If you are currently not on our mailing list but would like to be, please reach out. As always, we welcome your suggestions for future meetings as well. And yes, we will share the slides from our speakers today, as well as a link to a recording of today's meeting. So be on the lookout for those. We are working to develop our National Online Resource Center. Please send us your relevant bills, reports, resources, articles, and initiatives so we can populate the website with details about what's going on in your states regarding the long-term care workforce. If you would like to request on-site technical assistance services, please get in touch. We will be ramping up our promotion of those TA opportunities across various venues in the coming weeks. So if that would be of interest to your state, please let us know. And thanks so much again for joining us today and for participating in the discussion. We hope to see some of you at our next network meeting or sometime down the road. Thanks very much for joining us.
Thank you.
Thank you so much. Thank you, Amy, too.